Good morning, good afternoon, and good evening. Welcome to the discussion on questions of PSM. 15 questions in PSM. Most important ones, million times repeated in the exam. So these are the all important ones. Yes. Latex gloves after use should be discarded in. Yes. Now, blue bag is basically for glassware. And metallic body implants. Red bag is for recyclable stuffs. Yellow bag we burn. Black bag is for the general waste which is not infectious. Latex gloves, we can never burn latex gloves, and that's the reason the latex gloves will go into the red bag. I hope I'm clear with this. Yes guys, even if it is soiled, even if it is used, you cannot burn a latex gloves, because when you burn a latex gloves, there are fumes of PVC which have come out, polyvinyl chloride. Yes, that's not allowed in India. Yes guys, okay. Which of the following is discarded in the black bin? General waste, contaminated gloves, nope. Contaminated linens, nope. Mattress, nope. Paper and wrapper, yes. So answer to this question was option number 4. Mercury spill from a sphygmomanometer, question asked, what will you do? Yes. So when you talk about a mercury spill from sphygmomanometer, 3 R's. Recollect, reuse, recycle. But this recollection is never by hand. It is done using cardboard. So the answer to this question was option number 1. Collect using paper or cardboard and put in water tube or bucket. I hope I'm clear with this, guys. No doubt. Okay. If you accidentally spill blood while collecting samples in ward, the next best step is call hospital management team. No. Cover with absorbable paper. Yes, we do that, but that's not the ultimate step. Yes. Cover with 1% sodium chloride. Absolutely true. If it is a bigger spill, then it would have been 10% sodium chloride. Which mass vaccination would help during post-disaster? Single vaccine given post-disaster is measles and vitamin A. Yes guys? Okay. Definition of triage is characterization of victims of disaster based on first come first treat. Absolutely not. Age of victims, nope. Severity of injury and likelihoods of survival, true. Vulnerable groups, no. So answer is again 3. It is classified based on severity of injury and the likelihood of survival. The Glasgow Coma scale is which type of scale? Now see, in Glasgow Coma scale, we basically categorize the patient in order. So it is ordinal. If I would have said comma yes or comma no, it would have been nominal. There is no alphanumerical or numerical scales which is there. We have another for quantitative data which is called as metric scale. In ordinal, we order mild, moderate, severe. Yes guys? Okay. All of the following can be analyzed with a chi-square test, except chi-square test is basically done for qualitative data, whereas the t-test and ANOVA, this is done for quantitative data. Yes. So sex and stage of cancer, that is quali. Heart rate per minute or age, that is quanti. Benign or malignant and type of surgery, again that is quali. Age group and cancer stage, it is quali. So answer to this question was option number 2. BP of 60 patients were measured before and after taking an antihypertensive Which statistical test to be done? Now we're looking into before and after. So paired t-test, the only test out of this which was paired is a paired t-test. So many times in the exam, guys, you have to pick up with these clues. Now there will be many students who will be running after the fourth option. Need not bother, it is algorithm number 3. Just forget it. Yes. Two groups of patients, one with ischemic stroke and others with hemorrhagic stroke. The mean and standard deviations for a parameter is measured. Okay, mean and SD. That means they are talking about a quantitative data. And there are two groups. So there are two groups who are unpaired. Now why they are unpaired? Because one is the ischemic stroke, other is the hemorrhagic stroke. So they are unpaired. And we are talking about quantitative data. So the answer to this question would have been a unpaired t-test. Yes guys, I hope I'm clear with this. No doubt? Yes. Okay. Now, most common cause of 1 to 4 year mortality in India is, now it is pneumonia. Guys, this question is a recent update question. You will see different answer if you see older versions of any textbook, any teacher, or if you look into pediatrics. The most updated is here, your friend, your host, PSM Sid. Causes of pediatric mortality in India, updated in August 2022, already a year back, that too. Yes. Neonatal, most common is prematurity and low birth weight, followed by birth asphyxia and trauma, pneumonia, sepsis, congenital anomalies. Guys, you need not remember the percentage, but this sequence you should have an idea, because many times in your INICET question also you get to set in a sequence. Infant, we have prematurity and low birth weight, again the most common, followed by pneumonia, followed by birth asphyxia and trauma, diarrhea and congenital anomalies. For 1 to 4 years, it is pneumonia, injuries, diarrhea, PUO, pyrexia of unknown origin, and congenital anomalies. Shortcut, at least remember the most common ones for each age group. A pregnant female who has come in her second pregnancy, 8 weeks POG, with a history of stillbirth 2 years back, should receive. So that means stillbirth, that means it was above 28 weeks POG, that means definitely she had received 2 doses of DT, and the cutoff for booster is 3 years. So she should receive only 1 dose of DT. I hope I'm clear with this, guys. Identify the status of nutrition for children whose growth chart is given over here. Normal will be green. We do not have a mild malnutrition at all on this curve. Moderate malnutrition is yellow. Severe malnutrition is red. Answer was option number C. So for red, we will admit in NRC, Nutrition Rehab Center. Moderate, OPD management. Yes guys, okay. Which of the following is not considered as a principle of primary health care? Equal distribution. Guys, our health system is based on equitable distribution, not equal. A common error done by students. There has to be community participation because they're working out for the community. Intersectoral coordination, true, and definitely they use appropriate technologies. Which of the following is the committee for multi-purpose worker? Chadda committee, Bhor committee, Mukherjee committee, Kartar Singh committee. Multi-purpose worker is the Kartar Singh committee. Mukherjee committee said there should be a person who should deal with malaria and another person should deal with family planning. Chadda said one person only should deal with malaria and family planning. So what is the difference between Mukherjee and Chadda Saab? Mukherjee said one person each, that means 2 people. Bhor, first committee, it talks about your health system strengthening, making sub-centers, PHCs, CHCs to make up social physicians, and also talks about bringing the 3 months of internship posting. This is a very, very important table. This is all about the discussions on questions on PSM. If you have any query, Please feel free to tag me on Facebook at the rate Siddharth Shekhar Mishra, or on the official DAMS Telegram group, or you can WhatsApp me your queries at 9968859773, or even Insta me at Sid PSM. All the best, guys. Thank you and bye. Rock the show.